Hello, everyone. My name is Deanna Lau, and I am a developmental behavioral pediatrician in Santa Rosa, California. Today, I'm happy to share with you the results of my research during my training at Tufts Children's Hospital, which is on the timely receipt of autism diagnosis in children with coexisting developmental behavioral disorders. This research could not have been done without my research partners and mentors, Dr. David Tybor, Dr. Ellen Perrin, and Dr. Christina Sakai. My research was inspired by the stories of my patients. I noticed through my training that many of the school-age children that ended up having a diagnosis of autism had a prior existing diagnosis. Families often felt like the initial diagnosis did not entirely explain their child, and yet all new symptoms were attributed to this prior diagnosis. We know that diagnosis of autism can be made and is stable by 2 years. However, nationally, the average age of diagnosis is 4 years and 4 months, according to the Centers for Disease Control. Prior research suggests that for children with coexisting autism and ADHD, having a prior diagnosis of ADHD leads to a 3-year delay in autism diagnosis. So I wondered, does having a diagnosis of another common developmental behavioral disorder also associated with delays in autism diagnosis? I analyzed data from the 2011 National Survey of Pathways to Diagnosis and Services. This survey included children with a prior diagnosis of autism between the ages of 6 to 17 years old. We found that it took on average 29 months after parents report initial concern to a provider to receive the diagnosis of autism for children who are diagnosed concurrently. In contrast, if a child was diagnosed with the alternate developmental behavioral disorder first, it would take an average of 51 months to get their autism diagnosis. We found that receiving a diagnosis of developmental delay, intellectual disability, ADD, depression, or behavioral and cognitive disorder were all associated with late diagnosis of autism. Children who received a prior diagnosis of developmental delay were 3.5 times more likely to have a diagnosis of autism. Children with intellectual disability were 9.8 times more likely to get a late diagnosis. Children with ADD were 11 times more likely to get a late diagnosis, and children with depression were 8 times more likely to get a late diagnosis. And finally, those diagnosed with behavioral cognitive disorder were almost 10 times more likely to get a late autism diagnosis. Well, what does this all mean? Well, developmental behavioral disorders are complex because children are constantly changing. If you're a physician and your patient with an already diagnosed developmental disorder has new symptoms that doesn't fit, make sure you ask a subspecialist with more expertise in this area if another coexisting disorder is possible. Now, if you're a parent with a child with a neurodevelopmental difference and they develop new symptoms that also don't fit into that diagnosis, make sure you talk about your concerns to your child's primary care provider or a subspecialist. Diagnostic clarity matters because what children with neurodevelopmental differences need is the right diagnosis and the right therapies. So from a research standpoint, where do we go from here? We definitely need more research to clarify the characteristics of children with multiple coexisting developmental behavioral disorders and ASD so that we can better understand the presentation and identify them quicker. We also need streamlined and quick diagnostic pathways to decrease the amount of time that children with complex presentations are seen. Thank you so much for taking the time to hear about my research.